This is the Convene podcast.
The American Thoracic Society's mission to promote public respiratory health goes hand in hand with community service initiatives at its annual international conference. How one medical meeting weaves social impact into the program. Written and read by Michelle Russell, Editor-in-Chief of Convene.
Giving back and building forward in the destinations that host the American Thoracic Society's events is something that Emily Catanzaro, CMP, the Society's Senior Vice President of Meeting Services, takes very much to heart. At American Thoracic Society conferences, social good initiatives are baked into the program, from community service activities for volunteers to campaigns encouraging attendees to actively support minority-owned local small businesses in their host destinations during their stay. Catanzaro thinks all planners should give their events potential social impact in the cities where they meet the same consideration as their economic impact. Social impact is not an add-on to the meeting experience. It's a responsibility, she told Convene. Hosting conferences in a destination with a strong hospitality infrastructure creates a unique opportunity to channel economic activity into meaningful community engagement. Integrating volunteer initiatives, partnerships with local nonprofits, and legacy projects allow an event to extend its footprint beyond convention center walls and into the neighborhoods that benefit directly from service and investment. I think it's a planner's responsibility to leave the city better than you found it, and to look outside of your mission and your goals and have conversations with the city to understand, how can we help? We appreciate your hosting us. What do the people here need the most? At the American Thoracic Society, some community service projects may seem outside their mission, but are aligned with their broad public health goals. The Society, which represents healthcare professionals who advance respiratory, critical care, and sleep medicine, works with policymakers on issues like air pollution, climate change, and smoking cessation. We have staff in Washington that does incredible work, Catanzaro said, advocating for the Clean Air Act and working on issues like vaping, particularly with the youth, and environmental issues that impact us all, whether we are familiar with the thoracic community or not. At the American Thoracic Society 2025 International Conference in San Francisco last May, which attracted over 14,000 attendees from more than 100 countries, the Society left a lasting impact on its host city and brought its goal of health equity to life through outreach, partnerships, and support for local organizations, according to a website page listing its community activities. Much of that effort focused on engaging with youth, especially those in underrepresented communities. Before the conference kicked off in San Francisco, the American Thoracic Society hosted its first ever community outreach event in partnership with the Homeless Children's Network, with the overarching goal of creating pathways for future leaders in thoracic medicine. Students from the Homeless Children Network's Jabali Youth Advocacy Program were invited to an afternoon of educational exploration and mentorship, where American Thoracic Society Executive Committee members joined local physicians to guide a panel discussion. Students were given a chance to ask questions afterwards. What's really inspiring about this engagement is that many of our leaders are from different parts of the world, and they have very humble beginnings, Catanzaro said. They can connect with someone who may feel that they don't have access to a mentor, or imagine that pursuing a career in respiratory medicine is possible. It's really nice to hear the exchange and the storytelling that happens between American Thoracic Society leadership and the youth community. We like to understand, what barriers as a local youth are you facing? That focus on engaging local youth spilled over into a family event several days later during the conference, when the American Thoracic Society partnered with community leaders and healthcare providers to host Melanin Magnificence, which the Society's webpage described as a joyful and affirming event at the local YMCA celebrating Black health, wellness, and heritage. In addition to music, art, and food, the event offered free health talks given by American Thoracic Society volunteers and local clinicians. The hope is that these opportunities to meet and talk with American Thoracic Society members allow people to be more comfortable talking with specialists in general and encouraging their family members and friends to being open to meeting with a specialist before an emergency arises. Jamil Payden, Director of Diversity, Equity, and Community Outreach at the American Thoracic Society, said in a post on the website. At American Thoracic Society 2026, to be held May 15th through 20th at the Orange County Convention Center, we'll be working with the Boys and Girls Club of Orlando, as well as the Center Orlando, a nonprofit for the LGBT plus community, Catanzaro said, on social good projects. But ahead of that, the Society has already given Orlando a taste of its commitment to giving back. When the American Thoracic Society Board of Directors met in Orlando in February, they took time out of their meeting to put together care packages for Zebra Youth, a local organization offering housing, mental health services, and support for the LGBTQ plus youth. When you think about respiratory, you may not think about that community, but it's very important to our members to support people who are in need, she said. I love that American Thoracic Society is not only aligning with the youth to talk about opportunities in the medical field, but we're also aligning with groups that are in need and are so important to our community's values. It is the agenda. At American Thoracic Society 2025, the Society proved that community engagement doesn't have to happen outside the agenda. It is the agenda, the American Thoracic Society said on a web page describing its social impact activities in San Francisco. From uplifting youth voices and supporting diverse businesses to taking on providing health care for the unhoused and improving air quality for all, American Thoracic Society members and their conference attendees transformed their values into action. On the agenda also referred to the educational program itself. A conference keynote providing health care for unhoused individuals aimed to give American Thoracic Society attendees a framework to understand why so many people are unhoused and instill the possibility that we can get ourselves out of this crisis, said Margot Kushel, MD, Director of the University of California, San Francisco, Benioff Homelessness and Housing Initiative, and UCSF Action Research Center for Health Equity, one of the keynote speakers. We're often meeting unhoused patients at the worst times in their lives, but that isn't their entire trajectory, she said. Kushel connected the session to the work ATS, American Thoracic Society members do, noting that healthcare workers have an enormous say in policy, and I always hope that we will use our voice to make healthcare better, but also use our voice for issues adjacent to healthcare.
Remember to subscribe to the Convene podcast on your favorite listening platform to stay updated with our latest episodes. For further industry insights from the Convene team, head over to pcma.org/convene. My name is Maggie. Stay inspired, keep inspiring, and until next time.